What is brachytherapy treatment for prostate cancer? Those are the seeds that go in the prostate, correct?
Correct. Brachytherapy is, again, the internal delivery. I call it now MARS, or MRI-assisted radiosurgery, because we're utilizing MRI as sort of the next generation of conventional brachytherapy. And what it basically means is, under ultrasound guidance, utilizing MRI fusion, I'm able to place the radioactive seeds inside the prostate and inside the cancer. And that allows the highest amount of dose to escalate. And it has a very sharp fall off, meaning, again, it minimizes collateral damage to the rest, but it has the highest intraprostatic dose that we can get. So we use that at times as what we call monotherapy or single modality therapy for patients with low and intermediate risk localized prostate cancer. And as patients get more advanced disease into high or unfavorable intermediate risk, we can do it in conjunction with external beam radiation and really escalate that dose higher. There's a randomized trials that have been published now, whether it's been with external beam versus implant alone, or external beam and implant versus implant alone, or now adding external beam with an implant versus external beam alone. And these randomized trials have been critical in helping us understand the importance of brachytherapy in the management of prostate cancer. Now, not all patients are perfect candidates. So if you have a lot of urinary symptoms, I tend to not focus patients on brachytherapy because I don't want them to go in urinary retention. And what we do know from brachy is that as you deliver that radiation faster, the potential for urinary symptoms goes up during the acute phase and subacute phase of that treatment. And so there are some patients that are not ideal. Additionally, if a patient has a narrow pelvis, placing those needles and putting the seeds in the prostate is very difficult. So while some of the patients are ideal candidates for utilizing MARS or brachytherapy, some patients are not. And so that's what we also do in the consultation, is to evaluate what is the best treatment approach per that individual patient.